Welcome, everyone, to another webinar that is part of the Neurocriminology certification. In this webinar, we're going to take a deep dive into poor dietary practices, unhealthy eating habits. We'll talk about food insecurity, malnutrition, and what does the research literature say about these topics in relation to problematic behavior, criminal behavior, delinquent, antisocial, concerning behavior, and we'll look at it through that neurocriminological lens. My name's Jared Brown. I'll be the presenter for today's training. If you have questions, again, reach out anytime. Here's my email address. All of you should have a copy of today's training description along with the training objectives. Here's a copy of my brief professional biography. Again, I'm a professor, trainer, researcher, and consultant. I am very interested in the world of nutrition, and I'm so interested, I decided to enroll in my 5th master's degree, and I'm currently in a program right now that focuses on applied clinical nutrition. I've taken numerous trainings on the topic of nutrition. I hold a couple certifications related to nutrition. These are some of my certifications. One of them is a certification through the Functional Nutrition Alliance. I'm a certified functional nutrition counselor. I have a lot of certifications in other related health topics. These, again, are the areas that guide and inform the work I do. And I just want to throw a disclaimer statement in here. None of what I'm saying is nutritional advice. We're not diagnosing, treating, so don't take this information and try to diagnose, treat clients through a nutritional lens. Make sure if you do this kind of work, obviously you have the appropriate credentials, you're a qualified nutritionist, registered dietitian, check your state boards. So this is just for educational purposes only. So before we get deep in the weeds in the topic, we're going to talk about some foundational topics it's important for all of us to be aware of. The first one is the field of nutritional science. So this is kind of a broad spectrum overview. If you study this field, you're interested in human nutrition. It's a multidisciplinary field of study. If you study nutrition at this level and the program I'm in currently, you're going to learn about biochemistry, microbiology, human anatomy, physiology. You're going to learn about hormones. You're going to learn about the gut. It is a very fascinating field of study. There are many myths and facts that people can find. If you just go online, there's all kinds of myths out there about nutrition. You're going to learn about healthy versus unhealthy dietary practices. How does the human body absorb and metabolize and digest nutrients? How does it process these biochemical factors that are going on in the body, and how does it contribute to overall health and wellness? How does it contribute to diseases in some cases if someone is not getting the proper nutrients or they're just eating very unhealthy types of foods consistently? This field of study talks a lot about prevention and treatment of various health conditions through the use of nutritional kinds of interventions, all kinds of things. So it's a really fascinating field of study. There's entire graduate degree programs, doctorate degree programs that are dedicated to the field of nutritional science. A subsection of the field of nutrition is behavioral nutrition. So this is an area of study that if you're really interested in the interconnectedness between what we eat and how it influences human behavior, there's a lot of research literature you might want to check out as it pertains to this. I'm a major fan of integrated behavioral health approaches. So if any of you are working in the mental health field, there's a very strong argument to be made if you're working with clients diagnosed with a mental health or even substance use disorder. I'm not saying you, like, let's say you're a mental health professional listening to this. You would not per se develop a nutrition plan, but if you're aware of these topics, you would be in a better position to maybe ask some general questions, make a referral for your client to a qualified dietitian, a licensed nutritionist, or other healthcare provider, and work in conjunction with that other provider and really tackling the client's underlying mental health or behavioral health issues in a multidisciplinary format, which would include potentially prescribing nutritional interventions that would be done by that dietitian or licensed nutritionist. But also, if you, as the mental health professional, obviously working on skills and strategies to help improve overall mental health functioning, this field of study really talks about considering dietary practices, but also the client's tobacco use, the physical activity level, and alcohol consumption when trying to understand the complex nature of poor mental health. If you study integrative behavioral health, these are some terms that you would find in the research literature. It's typically a team-based approach. You're not doing it in isolation because humans are complex. If you're working with clients with complex health needs, medical or behavioral health, likely one professional can't tackle it all. There's so many moving parts. Because of those neurological factors we've talked about in this series, maybe it's biological factors, the psychological, the social, maybe there's some genetic factors, maybe there's prenatal factors. So integrated behavioral health, think of team approach. Culturally sensitive, you're trauma informed, you're recovery orientated, you're taking into account your client's health disparities. Integrative treatments, again, another term you'd want to be aware of, but integrative treatment, I love this quote, starts with accurate assessment and diagnosis. So if your client comes into your center or whatever kind of work you do, accurately understanding what is going on with your client is a frontline intervention. And maybe as a behavioral health specialist, maybe you are picking up on red flag indicators. You're hearing themes that this client is also dealing with a number of medical comorbidities or a number of nutritional deficiencies. This should, again, alert you to maybe referring that client to their healthcare provider as well. And when we think of integrative treatments, it's holistic. We're focusing not just on the mind or the body, but both. So basically, you're utilizing whole person interventions. We're going to talk about a lot of this today. Integrative care can be done face to face, it can be done remotely, it can be done via the web, telephone. Integrative care is often embedded in primary care clinics. Again, it's a team-based approach, but it's not always in a primary care clinic. It could be solo practitioners having their own company, but you're also working in tandem with a medical doctor, a nurse practitioner, some other qualified healthcare professional. Why am I spending a lot of time on integrative behavioral health or integrative treatments? Because if you look at the research literature, the benefits are many and varied, and it has been shown to enhance treatment outcomes for people with mental health and substance use issues. It has been shown in the research literature to play a vital role in helping your clients reduce hospitalizations, and it could play a role in reducing involvement over and over again in the criminal justice system. So, regardless of whatever field of study you're in, probation, corrections, law enforcement, human service, social service, mental health, drug and alcohol treatment programs, in my opinion, integrative approaches appear to lead to better outcomes when you're working with complex human behavior, health needs, and things of that nature. And a little bit more about integrative behavioral approaches, integrative behavioral health. If you're looking to take your knowledge to the next level, maybe you work in a large organization and you're trying to convince your higher ups why you might want to get additional training, starting to incorporate some of these practices into the good work you're doing. This would be one slide of many to consider. Integrative behavioral health approaches in conjunction with primary care providers can lead to a reduction in depression and anxiety. It can help your client improve their overall quality of life. It can help them better manage chronic disease states. It has been shown to lead to better outcomes in terms of professional and client connection. So it can help improve client engagement, and the list goes on and on and on. Another area of study I want to just introduce all of you to that I'm a major fan of, and I do a ton of work in the area of sleep, is behavioral sleep medicine. If you're working with clinical or forensic populations, more times than not, you're probably working with clients that are dealing with some level of sleep related issues. And what you're going to learn today is that oftentimes chronic sleep issues co-occur with poor dietary practices. Poor dietary practices can make sleep worse, and then a lot of times they go hand in hand. So this is just another area from that holistic, whole body, integrative kind of lens to maybe consider is not just what's going on with your client's nutritional status, but how are they sleeping? And I am a major fan of functional nutrition. As I showed you earlier, I do have a certification in functional nutrition. Why am I a major fan of this approach? Because it digs deeper into the weeds in terms of what's going on with your client. It's a whole person approach. Functional nutrition really focuses on food as medicine. It takes into account genetic, environmental, health factors, and lifestyle influences that could be playing a role in poor health outcomes. It focuses a lot on plant-based nutrition. This is basically why I'm studying functional nutrition. I sat down one day and just really thought of why do I like this field of study? This is what I came up with. I like holistic approaches. I like integrative health. I believe a one size fits all approach does not work because every person is different. We all have unique backgrounds. We all have different genetic makeups. Our biochemistry is different. So, really understanding each individual client is very, very helpful. I am a major fan too of really digging into the weeds in terms of what's going on with complex human behavior, not just looking at surface symptoms, but what is going on at the core, getting deep into the trenches. There's so many moving parts. And I do believe this is just where I'm at. I could be wrong on this, but I do believe this field of study also really complements the work I'm doing in the area of neurocriminology, psychoneuroimmunology. So if you've been part of this series, you know I've talked about this field of study, neurocounseling, and even psychogastroenterology. I'm really spending a lot of time on this too. Basically, behavioral health providers playing a role in helping improve digestive health is what this field of study is. And again, it really helps people, I think, when you understand these fields of study, better understand and being able to look deeper at what are some of the core drivers of human illness, diseases, and disorders. And we're not just, again, looking at the leaf of the problem. The leaf of the problem could be symptoms. Now, again, I'll give you an example. If any of you have ever worked with a client who's dealing with depression, sometimes people think depression is pretty clear cut. So someone's having symptoms of depression, it's pretty clear cut. I would make a strong argument that depression is one of the more complicated health disorders out there because if you go deeper in the weeds, there's a million factors at play that could be contributing to someone's depression. What they eat, who they associate with, what's their relationship status like, what's going on with their neurohormones, their neurotransmitters, the gut, the HPA axis, the list goes on and on and on. So this is basically why I'm studying functional nutrition. And when you study nutrition, there is some evidence and research studies that talk about learning about psychoneuroendocrine immunology. So again, if you don't remember what this field of study is, just think of it as a kind of more of an integrative discipline. It takes into account behavioral factors, nutritional factors, cognitive, social, emotional. It takes into account what is going on with our hormones, what's going on with the gut. It's really a fascinating field of study, and it helps us better understand human illness and disease. And nutrition is talked about in this field of study. So, psychoneuroimmunology, or in some cases, it's been referred to as psychoneuroendocrine immunology. So, psycho, think of the brain, psychology, neuroscience. The endocrine system, HPA axis, the gut, our hormones, and then how does all of these things influence our immune system, inflammation? And this field of study is fascinating as well because what we think, what's our emotional state like, our stress level, our anger level, can have a profound impact on our hormones and our immune health as well. And psychogastroenterology, again, most of us probably have not heard of this term up until the last few years. It's a fairly new term. It's been referred to in the literature as gastrointestinal psychology. You're going to be obviously studying the gut brain health axis. You're going to learn about organic and functional gastrointestinal disorders. If you remember, I've talked about previously disorders of gut brain interaction. Health psychology talks about this in some cases. It talks about brain gut psychotherapies, behavioral symptom management interventions, teaching clients to have better coping skills that can also help them improve digestive health functioning. This field of study talks about psychoeducation, so teaching clients about the interconnectedness between their mood state and their gut health, teaching clients relaxation strategies. The list goes on. And neurocounseling, if any of you are doing any kind of therapy, counseling, social work, case management, even if you're not like a counselor or therapist, the strategies and principles from the field of neurocounseling likely can lead to better outcomes when you're interviewing a client, you're trying to understand your client's thinking and their learning styles. Neurocounseling basically is the integration of neuroscience research into counseling practice. So you're going to want to understand the nervous system, how the body, our mood, our behaviors, and our cognitions are really all interconnected. And the heart of obviously this training program is neurocriminology. So at this point, all of you will have a good understanding of what this field of study is. And just to remind us, these are some of the variables and topics that are talked about under the umbrella of neurocriminology. Obviously, today, the focus is on nutrition, but poor nutrition absolutely has an impact on our hormones, on our neurotransmitters. It impacts all kinds of things in our body, but these are other topics you'd want to be aware of when studying the field of neurocriminology. And part of neurocriminology is understanding the biological risk factors that may contribute to problematic, concerning, antisocial, aggressive, and violent behavior. And just to remind us, these are some of the biological factors that we have discussed at various times in this training series. So let's just take a brief review. Problematic birth outcomes may be a biological factor in some cases. What was going on in utero? Was mom during pregnancy using drugs, alcohol, tobacco products, malnutrition in utero or any point in life? Look at some of the literature on low cholesterol levels, some really fascinating literature that has been talked about as a potential biological risk factor for violent behavior. Lead exposure, environmental toxins, head injuries. Again, we know that maybe half of people or more in prison have histories of head trauma. We'll talk more about this low arousal level in the psychophysiological dysregulation training module. And in the hormones, neurotransmitters, we'll talk a lot about serotonin, cholesterol, or cortisol, testosterone, lots and lots of things to think about. All right, so that's a foundational overview, lots and lots of topics to think about. This next section, we're just going to talk about some of the basics of nutrition. Now, we all know, obviously, nutrition plays a critical role in helping live a healthier life. Have you known people that just don't eat healthy day in and day out? They may be able to get away with that for a period of time, but if someone eats unhealthy over and over and over again, year after year, decade after decade, more times than not, that's going to catch up with them at some point. And it can absolutely play a role in developing diseases, illnesses, disorders. And the opposite is true. People that go through life who eat really healthy, that is a protective factor against many diseases and illnesses and disorders. Again, there's all kinds of other factors to take into account, but nutrition, in my opinion, is a major, major component to this process. So when we think about the importance of nutrition, when people eat well, prenatally, early childhood, teenage years, adulthood, throughout the lifespan, it plays a critical role in improving health outcomes. So if we look at the importance of nutrition early on in life, it's been shown to lead to improved child and infant health outcomes. Mothers who eat healthy during pregnancy, that oftentimes plays a vital role in promoting prenatal health. People that eat healthier, more times than not, again, there's all kinds of other factors. It can help support immune system functioning. It can lower the risk of non-communicable diseases. Look at the rates of diabetes around the world over the past several decades. Look at the rates of cardiovascular disease risk factors over the last several decades. You will see these numbers that have skyrocketed worldwide. Certain countries, it's worse in. Why is that the case? Well, a big part of that is going to be what we eat. Obviously, there's other factors to take into account. Genetics, sedentary behaviors is oftentimes talked about, but we'll talk about all these things throughout this module. Very, very important to learn about food, in my opinion. Understanding food, what role it plays, understanding nutrients, understanding what happens when we don't eat enough, understanding what happens when we eat too much. Learning about food, I think, is vital to helping improve health outcomes. Now, depending on what website you look at, this came from the CDC's website. Proper nutrition, again, it's different for everyone. Obviously, if someone's consuming high degrees of fast food and ultra processed foods, that's always going to be bad. But everyone is wired differently. So, again, another reason why working with a qualified professional who understands the interconnectedness between like biochemistry and genetics and all of these things, because there's so many factors that play into what constitutes a truly healthy diet for an individual. But typically, if you look at some of the guidelines, fruits and vegetables, whole grains, more seafood, maybe it's more lean meat. We'll talk about all these things. If people are consuming tons and tons of sugar, lots of sodium, tons of saturated fats, obviously that's not healthy for someone. And if we look at the various groups of nutrients found in foods, this is just an overview. We're not going to get in the weeds with this per se, but Qualified medical providers obviously will educate clients about these topics in many, many ways. Proper nutrition obviously has a profound impact on health outcomes, not just physical health, but behavioral health, brain health. It can play a role in preventing certain diseases. It plays a vital role in helping people maintain weight. Now, obesity, chronic weight gain is very complex. That's a whole nother training in and of itself. It's not just nutrition, but obviously that plays a vital role. And nutrition supports well-being. Well-being literature is vast. So if you're ever focused on enhancing client well-being, obviously taking into account dietary factors in conjunction with healthcare providers, your client's sleep patterns, their overall activity level. Are you working with clients that live a sedentary lifestyle? Taking into account social factors, well-being literature is extremely vast, and it's a fascinating field of study. If you're looking for some more resources, different models that are out there, different screening tools found in the well-being literature, shoot me an email. I have links to multiple resources I'd be more than happy to share with you. This next section is getting into the weeds in terms of what constitutes unhealthy dietary practices. So when we think of unhealthy versus healthy, two of the main types of diets that have been researched, Mediterranean diet, typically healthier, the Western diet, typically unhealthy. We'll talk more about this as we go. But when we look at the research literature on healthy versus unhealthy eating patterns, dietary practices, what are some things that come up? Cost is typically a factor. Most of the time, and again, there's other factors to take into account. Most of the time, it does cost more money to eat healthier. Not always, depending on one's level of education, cooking skills, but typically it's much cheaper to go through the drive-through or get food at the gas station than it is from like a co-op or a place that sells more, maybe more organic-based foods. Sometimes the taste can be different between them. Not always. Unhealthy foods sometimes may have a higher addictive quality. Look at junk food consumption, excessive sugar, sweetened beverage consumption. The availability between these are often different, especially when we're talking about food swamps, food deserts, food insecurity. The types of oils that are found in healthy eating patterns versus unhealthy feeding patterns are different. The ingredients are typically different. So, those are just a few factors to take into account. Unfortunately, if you look at the research, people that eat unhealthy day in and day out, it could lead to increases in weight gain. There's studies that talk about it could play a factor in sleep apnea, type 2 diabetes, heart disease, and certain kinds of cancers. And again, it's not just the eating, there's other factors to take into account. The Western diet is typically going to be a threat to human health. People that eat this way day in and day out likely have worse health outcomes compared to people that don't eat this way. The main traits of the Western diet are going to be higher consumptions of processed foods, red meats, sugars, saturated fats, and typically lower intakes of fiber and fruits and vegetables. The foods that dominate the Western diet, artificial sweeteners and preservatives, which would be part of some of those processed food ingredients, processed grains, refined oils. So when you study the Western diet, very important to understand that it truly is a threat to human health and wellness. So if we look at this, just to visually show you here, we got the processed grains, the refined oils, unhealthy fats, sugar, salts, artificial sweeteners, and preservatives. Also, foods that would fall under this umbrella, sugar sweetened beverages, fried foods, particularly when they're using really unhealthy oils, lots of processed and even unprocessed red meats, lots of desserts and snacks, particularly ones that are loaded with ingredients that are processed. A lot of times they're going to have more sugar in them, multiple ingredients, maybe a lot of ingredients we can't even pronounce. And if you look at some of the consequences associated with consuming a high degree of foods that fall under the Western diet, taking a look at this slide, it can throw off the gut. Again, remember the gut brain health connection. So if the gut is consistently off, that's a pretty good indication that that can have profound negative impacts on brain health. It can increase neuroinflammation. So neuroinflammation is basically inflammation in the brain and the spinal cord. And if any of you've studied diabetes, prediabetes, you're probably well aware of impaired insulin signaling, glucose metabolism abnormalities. These are big, big topics. All of these things have been linked with a higher consumption of foods that fall into the Western diet. Now, I'm not talking about just once in a while. Again, this is clients that maybe eat this way day in and day out. If you look at the research literature on the Western diet, more and more studies have been published on this way of eating in recent years. Really fascinating research literature. But people that eat this way day in and day out may be more likely to be dealing with obesity, chronic inflammation. Why do you want to care about chronic inflammation? Because most diseases, not all, but most diseases are often connected to higher levels of inflammation in the body. So chronic inflammation over the long haul has been linked with multiple issues, including an increase in depression. Why have we seen such a dramatic increase in allergies in the United States and around the world in recent decades? Partially linked to the way we eat. Diabetes, type 2 diabetes, autoimmune disorders, metabolic issues. Metabolic issues are very, very common in clients that are dealing with very serious mental health issues, particularly if they're dealing with food insecurity, living a sedentary lifestyle. Metabolic syndrome, metabolic issues, really cluster of symptoms, insulin issues, diabetes, cardiovascular disease, risk factors, things of that nature. And again, if you're listening to this and you're asking yourself, why should I care about the Western diet if I'm working in the mental health, behavioral health field? Because you're going to find numerous studies that talk about this way of eating may play a critical role in exacerbating neuropsychiatric problems. Ultra processed foods are really a hallmark of the Western diet. So when we think about ultra processed foods, most of the time these are foods that are often shelf stable, which basically means they're loaded with preservatives and they probably can sit on the shelf for a very long period of time. They're usually ready to eat products. A lot of times these kinds of foods are packaged in packages that look very appealing. They're very attractive. They look fun to eat. They're marketed that way because we know that people are attracted to those kinds of products. They're loaded with added colorings, flavorings, emulsifiers, thickeners. They usually have lower nutrient dense value, but they're high in energy. So they're a lot of times loaded with calories, higher contents of saturated trans fats, lots of added sugars, lots of times, lots of sodium in there. Typically, ultra processed foods, again, depending on the food, is likely going to have lower levels of certain vitamins in there. You look at the research, it talks about lower levels of vitamin A, C, and D, and E, and B3 and B12. A lot of times they have lower levels of magnesium, fiber, zinc, protein, potassium. We could spend all day or all month just on those vitamins and minerals. But just know if someone's not getting the proper nutrients, likely that can lead to poor health outcomes. So those are a few things you'd want to consider with ultra processed foods. Why should we care about this topic? Because if people eat ultra processed foods day in and day out, it's been linked with more gut issues. Again, gut brain health access. If the gut's off, typically our mood's off. It can make mental health problems worse. This way of eating has been linked with higher levels of asthma, obesity, the hypertension, the metabolic issues, and unfortunately, some types of cancer. There's actually some studies too that have looked at high consumptions of these kinds of food in utero. So mother is consuming a high degree of ultra processed foods during pregnancy. Some studies have shown that that could lead to problematic birth outcomes. So it's just something to think about. Ultra processed foods, depending on the article study you read, typically have 5 or more ingredients. Again, this can differ depending on the guidelines you look at, the study you look at. These are just some examples of highly processed foods. If you are eating a high degree of foods that are microwavable, a lot of times, obviously, those are going to be processed foods. If someone is consistently going through the drive-through every day for lunch or stopping off at the gas station, you're probably consuming a high degree of processed foods. If you look at some of the articles published on this, it talks about ice cream, fish nuggets, French fries, hot dogs, burgers, sugar sweetened beverages. These kind of things are all typically very ultra processed kinds of foods. Again, you can look at all kinds of foods out there, candies, cookies, pastries, lots of breakfast cereals, oftentimes very processed, certain kinds of like sugar sweetened beverages, even milk based drinks that might be loaded with lots of sugars and processed ingredients, and even being aware of certain kinds of fruit based yogurts, fruit punch, these kinds of things, really starting to understand labeling, working with a nutritionist, maybe increasing your nutritional literacy, how to read labels, understanding what those ingredients truly mean can be very helpful. When we talk about unhealthy dietary patterns, too, very, very important to understand the literature on fast food consumption. There's a lot of definitions that fall into this umbrella. I just threw this on here. This is probably one of the better visuals that I could find in the literature. So we have fast foods. We all know what that is. You go to the drive-through, you go in a sit-down restaurant, you get your food within a few minutes. Junk food, got to be aware of that topic as well. Being aware of instant foods and even certain kinds of street-based foods. So again, learning about ingredients, depending on what kind of oils are in there and how the food is prepared and processed, all these things, very important. The overconsumption of fast food is a threat to human health. And if you look at the research literature on fast food consumption, typically they're going to taste really good. Why? Because a lot of times they're loaded with sugar, they're loaded with salt, they have higher degrees of energy. So you get a burst of energy, but then maybe a crash because your blood sugar levels are out of whack. Lots of fat, saturated fatty acids, trans fatty acids. Typically, again, if someone is consuming a high degree of fast food, they also are consuming higher amounts of sugar sweetened beverages, the research says. Taking a look at this too, if somebody is consuming a high degree of fast food day in and day out, it can lead to poor health outcomes. I have family members right now that eat this way day in and day out. And some of these family members are absolutely dealing with some of these issues on this particular slide. Again, it's not just the fast food, but think about their sleep patterns. Think about their coping strategies. Are they living a sedentary lifestyle? Again, it's not just the food, but it does play a huge role. When studying this too, just understanding the term junk food consumption. Most Americans consume a lot of junk food. I'm guilty as charged. I changed my diet several years ago, made some major changes, feel a lot better. But at times, I mean, none of us can be perfect. We do consume food like this. And if you look at the junk food consumption literature, there is a term you'll find in the literature that talks about junk food addiction. Now, it's a relatively new term. There's some controversy associated with it, but just my own observations, I have seen family members personally appear to be very addicted to certain kinds of foods, sugar in particular. I've seen it firsthand, but again, there's controversy. Is junk food truly addictive, just like drugs and alcohol? Junk food items, again, there's a long list of things, but these are just some things you'd want to be aware of that are talked about in the literature. So just being aware, again, maybe the client's working with a nutritionist or dietitian or functional medicine provider. They're probably going to dig into the weeds on this, learn about their dietary patterns, and just find out what foods they're eating, what foods they like, maybe helping them make some minor changes starting out. But junk food items are all over the map. These are just some to be aware of. And if you look at some of the literature too, excessive consumption of junk food in adolescence, this is just one study of many, and this study focused on adolescents, it may play a role in increasing behavioral problems, hyperactivity behaviors, depression, daytime fatigue. I've seen this play out too with adults. This next section, we're going to get in the weeds with clinical considerations. So if any of you are working in the mental health or medical health fields, this will be right up your alley. So again, people that eat this way day in and day out, foods under the Western diet, it has been linked with an increase in mental health and behavioral health challenges. Again, there's all kinds of triggers for poor mental health. What we eat is a trigger. Do we become extremely angry? Anger control issues could be a trigger. Do we feel extremely betrayed or hurt by someone or disrespected? That could be a trigger. Grief and loss issues, extreme levels of shame, self-esteem, negative emotional mood states. Maybe someone has a tendency to have really engage in negative self-talk. Maybe it's a high level of self-pity, high levels of social isolation. The list is many and varied in terms of what can make our mental health and behavioral health worse. Just know that poor dietary practices is a factor as well to take into account. There's several studies that have talked about the role that nutrition plays in behavioral health. If you're not familiar with this term behavioral health, basically it's a term that describes the connectiveness between our physical health, our emotional and behavioral health. It takes into account that mind body connection. When you study behavioral health, you probably learn about stress, anxiety, depression, relationship factors, grief and loss factors. Are there any addictive tendencies? Learning disabilities is talked about in this literature. Social isolation. If you study behavioral health, you probably want to also take into account your clients' exercise habits, screen time behaviors. What do they eat? What kind of sleep are they getting? Are they getting good sleep? Are they waking up exhausted? What do they consume in terms of beverages? Are they consuming a high degree of caffeine, sugar sweetened beverages? Are they not consuming hardly any water? And they're dealing with chronic low grade dehydration. These are all factors to take into account. Now, part of this series, you've probably heard me talk about abnormal glucose metabolism, blood sugar dysregulation just a little bit. This is a huge topic that I don't think is talked about that much in college level or training programs. particularly for mental health, forensic, or criminal justice based professionals. This is a big, big topic that I highly recommend you all learn about. Because if our blood sugar levels are all over the map, that has been linked with higher degrees of irritability, anxiety, inattentiveness, hyperactivity levels. Very important. And what we eat does play a role in this. This was an article some of my friends and I wrote. My good friend Janina Schick, COO of APHIS, is part of this article. I highly recommend checking this article out. We wrote it in a way that's very practical for any really interviewer to take into account. Now, this is for criminal justice professionals, but if you're working in any of the helping professions, I highly recommend checking it out. I put a link in here for you. It's online. It'll probably take you 3 to 5 minutes to read. It gives a lot of practical tips, ideas, reminders to take into account why we should care about blood sugar dysregulation. You work with folks with serious mental health disorders. Depending on the state you live in, the criteria may be different, but typically in the state of Minnesota, if you work with someone with a serious and persistent mental health issue, that's going to be someone who's diagnosed with schizophrenia, schizoaffective disorder, bipolar disorder, major depressive disorder. More times than not, if you're working with someone with one of these disorders, particularly if they're untreated and they don't have a lot of means, they don't have good family support, a lot of times they're not eating too healthy. And I have seen this play out firsthand on numerous cases I've consulted on. When the client is not eating healthy day in and day out, it can make their symptoms of these disorders much worse. If you go through the research literature, and there's a lot, as it pertains to serious mental health issues and why some clients with these disorders don't eat that healthy, these are some of the variables that are talked about. Unfortunately, we know from the research literature, people with some of these disorders, and if they don't live a healthy lifestyle, unfortunately pass away several years sooner than the general population. Maybe the person's dealing with problematic eating patterns, binge eating, meal skipping behaviors. Food insecurity is a big topic to take into account. We're going to talk about food insecurity and malnutrition today. Weight gain, weight loss, depression, sleep issues, excessive screen time exposure, daytime fatigue, isolation, health literacy issues. This could also include nutritional literacy issues, which basically means maybe the client does not know how to read a label. Maybe they struggle with going to the dentist, going to their healthcare provider. Mobility issues have been talked about in this literature. Unfortunately, traumatic brain injuries are higher in this population. Maybe there's an undiagnosed learning disability. Memory issues is a huge factor to take into account. For some clients, it could be impulse control issues, self-control deficits. What happens if the client is also dealing with a co-occurring drug or alcohol problem, excessive tobacco use? I've seen this play out numerous times in cases I've consulted on where the client is spending hundreds of dollars per month on tobacco products, and now they don't have a lot of money left over for higher quality nutrition. And what happens if the client is really following the umbrella of poverty or dealing with homelessness? So these are some of the factors. By no means is this an all-encompassing list, but this is a good list to be aware of. What about risky health behaviors? So being aware that in some cases, individuals with some of these disorders may have a tendency to have a higher degree of sedentary behavior. So they're not moving that much, getting a lot of exercise. I've seen this play out where it's contributed to more joint pain, There's a case I consulted on. I can remember the client was extremely overweight, excessive screen time exposure, just didn't get up and go to the bathroom that much, didn't drink a lot of water, ended up having some problems with her kidneys. All of these factors could be considered potential risky health behaviors. And when we think about some of the factors again that could get in the way of a client with a serious mental health issue, following through with treatment, taking care of themselves, these are some of the factors you will find in the research literature. Sometimes the younger the client is, that could be a factor because maybe they just have underdeveloped cognitive skills. Minority status may be a factor in some cases. Homelessness, poor insight. So maybe the client is dealing with anasagosia and they have complete lack of awareness that they even have a serious mental health issue. Drug and alcohol problems, as I mentioned before, cognitive deficits. This could be brain-based problems, executive functioning deficits, metacognition issues, learning, attention, memory, those kinds of things. Maybe that client has very limited social support. Maybe they go to therapy, but they're matched with a therapist that's just not a good match. Maybe they go to a program and it's a one size fits all approach. And remember, I just don't believe a one size fits all approach. It just doesn't work because of the complex nature of human behavior. And maybe the client is on just so many medications, they're dealing with all kinds of side effects. And are they dealing with financial issues, environmental issues? Maybe they're living in an environment they're exposed to all kinds of pollution or environmental toxins. And maybe that client has absolutely lack of routine in their day-to-day life. These are just some factors you'd want to take into account. Other things to consider that could contribute to more risk-taking behaviors. Again, this study is related to adolescents, but I think we can apply it to adults as well. But if you're working with somebody who has a long history of risk-taking behaviors, these are some of the variables you might want to consider during an intake screening process. And if you're noticing some of these factors going on with your client, it could be important target areas for potential intervention. And when we think of risky behaviors, this is what the research says. This is not an all-encompassing list, but if you can help your clients improve in these areas, it likely could play a role in improving positive health outcomes. So if your client has a long history of engaging in thrill-seeking behaviors, which could be very dangerous to them or others, they misuse alcohol, they're living a sedentary lifestyle, maybe they're engaging in deliberate self-harm, they smoke cigarettes, they have a history of financial risk-taking behaviors, maybe they're on the screen for prolonged periods of time, so they're on the screen late at night. Maybe they're not getting good sleep, looking at their eating patterns, their sugar consumption habits. Maybe they're consuming a very high degree of energy drinks that are loaded with caffeine. These are all potential risky behaviors that could lead to more poor health outcomes for your clients. Plenty of research literature also supports the fact that if you are working with clients with drug and alcohol problems, understanding these topics could play a vital role in helping your clients stay sober. If you are a drug and alcohol treatment program, the research is very clear on this. If you have the means, consulting, working with a qualified nutritionist or dietitian is highly recommended when developing a holistic, integrative substance use treatment program, taking into account nutritional factors, sleep factors, gut factors, inflammation, blood sugar dysregulation, on top of the good things you're already doing is highly recommended. If you work with clients with alcohol problems, plenty of research supports the fact that chronic alcohol use has been linked with immune system dysfunction. Why is that the case? Chronic alcohol use can throw off our neurotransmitters, our hormones. It can impact our HPA axis. It can throw off our sleep. A lot of times, people who are consuming high degrees of alcohol may be dealing with more nutritional deficiencies, or they just don't eat that healthy. These are all factors to take into account. And we all know that the overconsumption of alcohol is not good, but just to remind us that if you're working with clients that consume a high degree of alcohol, these are some of the factors to take into account. Risky driving behaviors, blacking out behaviors that could increase vulnerability and victimization. Alcohol use problems a lot of times are involved in violent or aggressive behavior. It could be a factor with sexual risk taking, and it could place that client at greater risk of injury and head injury as well. So, metabolic syndrome, we spoke about that before, but if you're working with folks with complex behavioral and mental health issues, learning about metabolic syndrome would be highly recommended because a higher percentage of folks with serious mental health challenges are also dealing with co-occurring metabolic based issues. And unhealthy lifestyle practices oftentimes play a role in contributing to more metabolic dysfunction, including excessive tobacco exposure, excessive consumption of alcohol, not sleeping well, not exercising and living a very sedentary lifestyle, and just eating foods that are, again, not good for us. And I just wanted to show all of us this. Again, we're not going to spend time on each of these micronutrients. But again, depression's complex. And again, if you're working with folks with depression or mood related problems, plenty of research says that deficiencies in omega-3 fatty acids, vitamin B vitamins, magnesium, and zinc could play a role. This is another reason why working with other providers who have the qualifications to dig deeper in the weeds with this can play a vital role in helping clients improve overall mood state. And again, sleep and unhealthy dietary practices oftentimes go hand in hand. And if you're working with folks in clinical or forensic arenas, high percentage of clients probably don't get optimal sleep. So taking that into account through this unhealthy dietary lens, very important. And when we think about what are some factors associated with like improper eating attitudes, taking a look at this slide, obviously I underline a few things. If you were to go through this literature, these are some of the main themes that do emerge. Emotional lability. So these would be clients that you're working with that have just a roller coaster ride of emotions, up and down mood swings. We all know about alexithymia now. This is emotional blindness. This would be a client that struggles with naming, labeling, processing, making sense of emotions. Very, very common in clinical and forensic settings. Impulse control issues, high levels of anxiety, depression. Some people may obsess, confusion, brain-based issues, clients with lower levels of resilience, self-efficacy issues, low self-esteem, trauma and attachment histories, emotional eating patterns, meal skipping, and binge eating behaviors are some of the more common variables to take into account if your client has a pattern of improper eating attitudes. So we're going to take a quick breather, everyone. We've covered a lot of ground. We'll just take a quick break and we'll come back and we'll jump into how does stress and trauma and other life adversities factor into this discussion today? Well, welcome back, everyone. So again, this next section, stress, trauma, other life adversities through kind of that nutrition dietary lens. Nutritional deficiencies, toxic stress. I think it's very important to understand the two of these. So if you're working with clients that are dealing with a high degree of toxic stress exposure, that should alert you to the fact that stress in that person's life has reached a point where that client probably can't cope with that stress anymore. This is more severe forms of stress. It's more chronic, it's more prolonged. And a lot of times, when we're dealing with a high degree of toxic stress exposure, that may also contribute to poor eating habits like stress eating. If someone's dealing with a high degree of depression, loneliness, grief, and loss issues, maybe they're just extremely worried and fearful. Maybe they just lost a job or they're on the verge of homelessness. Those are a few examples of potential toxic stress exposure. So, very important if you're working in the area of toxic stress, trauma, understanding the fact that in some cases nutritional deficiencies likely co-occur with your client. So these are examples of toxic stressors. They're all over the map. Again, these are some other ones to take into account, but maybe it's a client living in a very, very crowded home situation and they never have privacy. They're constantly getting woke up all the time, so they're chronically sleep deprived. Interestingly, if you look at this research, secondhand smoke exposure could be a toxic stressor for some individuals. I can remember growing up, my grandpa smoked like it was going out of style. I hated the smell of that. I can't imagine if I lived in an environment where I was exposed to that secondhand smoke all day long, every single day. Nutritional deficiencies, malnutrition, food insecurity, chronic unemployment, and social isolation, social loneliness, again, are all contributing factors to toxic stressors. And if somebody is dealing with a high degree of stress, in some cases, that can be linked with changes in eating behavior. Again, it really depends on the individual. Everyone is different. But I've known people when they're under a ton of stress, they just don't have any appetite. So now they skip meals all day long. I've known people under tons of stress who binge eat and just can't get enough sugar and carbs and things of that nature. So it can go both ways. If you've ever worked with someone with uncontrolled emotional eating, that can be kind of scary. I've seen this with actually somebody I know personally. This can be very scary and can lead to extreme energy fluctuations, blood sugar dysregulation, irritability, things of that nature. And if people are consuming higher energy portions, this could be a client who goes to the buffet and is binge eating on the buffet food. This could be a client who is pounding down these sugar sweetened beverages all day long. Somebody that is ordering takeout food or going through the drive through over and over and over again. You're getting a lot of energy there from that food, but a lot of times it can drive the bus and make stress even worse. Self control is another variable we want to take into account when we're talking about these factors. Higher levels of self control are, it really is a protective factor. So, this is what the research says in a nutshell. So, people with greater levels of self control can manage strong emotions much more effectively. Physiological recovery from stress. We're going to talk a lot about this in the physiological dysregulation training I'll be giving coming up. But if you become physiologically dysregulated, heart rate variability changes, maybe a lot of shakiness in the body, having better self control can help people recover from that more quickly. Today, we're covering this. Better self control is oftentimes linked with better eating habits. So, this might be a critical component to intervention. People with better self control typically live longer, they're healthier, they're happier, they do better in school, they have less mental health problems. When you are trying to get a snapshot into that client's life in terms of how their self control is, What is their relationship like with food? What are their sleeping patterns like? Do they know how to manage money, or do they spend money quickly? Could that be an indication of a self-control deficit? What's their relationship like with sugar, tobacco, caffeine? What are their driving habits like? What's their criminal history patterns like? This could give you a better idea as to maybe some problem areas a client could be dealing with as it pertains to self-control. Chronic stress has been linked with the overconsumption of sugar. And if you look at the sugar literature, excessive sugar consumption, without a doubt in my mind, is a threat to human health. You will find numerous studies that talk about this. Chronic stress over the long haul has been linked with more anger issues. So, negative emotionality, high levels of irritability, anger problems, emotional dysregulation, cognitive distortions could be like more all or nothing thinking, black and white thinking, catastrophizing, rumination, decreased inhibition. So remember the training we all did together on executive dysfunction. Inhibitions are parking brake. Disinhibition means the parking brake in our brain isn't working that well, so we might be more impulsive. We might be more impatient. We don't think through things. Chronic stress can make all of these things worse. Other things to consider when we're thinking about this through a stress lens. Could the client also be dealing with social isolation? Do they feel lonely? Do they feel empty? If your client is dealing with tons of stress, social isolation, and lots of loneliness, there's a high degree that they may not be eating that healthy. Again, it's not always going to be 100%, but there is a connection between these variables in poor eating habits. So these could be very important target areas for potential behavioral health interventions, helping the client manage stress better, getting them connected to more social supports, which then hopefully can reduce isolation and loneliness. If we think about some of the risk factors associated with loneliness, there's a lot of them out there. Think of COVID, how that factored into this. Without a doubt, for some people, loneliness went way up during the heart of COVID, the lockdowns. So be aware of loneliness and its interconnectedness in some cases with poor eating habits. The consequences of loneliness are many and varied. Long-term loneliness over the long haul has been linked with all kinds of poor health outcomes. This is one article of many that talks about this. It could play a role in increasing hypertension. It may increase cardiovascular disease and strokes for some people, cognitive decline and impairment, and unfortunately, it may contribute to more premature death for some people, depending on how long the loneliness was going on for. And for some people, chronic loneliness may be associated with higher consumptions of tobacco products, sugar products, and other kinds of poor health outcomes. Other things to consider: loneliness in a lot of cases oftentimes is associated with living a sedentary lifestyle. So people who are dealing with a high degree of loneliness may not exercise that much. They may be glued to the screen, which could trickle down more obesity, the smoking I mentioned before, and all of these things can make chronic health conditions worse and increase psychological distress, which could contribute to the development of a full-blown mental health disorder. Trauma. If you work with clients through a trauma lens, a lot of times folks with high levels of trauma in their histories that have gone untreated may turn to food as a coping mechanism in some cases. So high degrees of trauma may be associated with more unhealthy eating behaviors for some people. If you look at the trauma literature, this is interesting too. There's some studies that have found that sugar sweetened beverage consumption could be a factor among some people with trauma. So, excessive sugar consumption lots of times can make stress worse. This is a variable to take into account if you're doing any trauma work. There's a strong argument to be made as part of a comprehensive trauma informed approach, also working in conjunction with a nutritionist or dietitian may be warranted. If we look at this, sugar sweetened beverages, if you're not familiar with what these are, they're liquid carbohydrates. They are a threat to human health. If you look at the research on this in the United States, they're likely the single largest source of added calories in the American diet. It is absolutely a factor to take into account when we're talking about poor health outcomes. There's all kinds of beverages that fall under the umbrella of sugar sweetened beverages. If you look at the research literature on excessive sugar sweetened beverage consumption, there's a lot of studies that have been published on this. Some studies have looked at this within the context of weight gain, anxiety, asthma, increases in inflammation, increases in insulin sensitivity. There's a couple studies that have looked at this within the context of kidney disease, non-alcoholic liver disease. A couple studies have also looked at this within the context of poor academic outcomes, self-regulation deficits, sleep issues, dental problems. The list goes on and on and on. If you have ever studied the adverse childhood experiences research, you will find several studies that talk about individuals that have a higher ACEs score may not eat as healthy. So someone with a higher ACEs score would indicate they've had more trauma happen to them before the age of 18. When you study the ACEs, just know that there is a dose-dependent relationship between higher amounts of trauma in childhood and more poor health outcomes in adulthood. Dose-dependent relationship would just mean the higher numbers of trauma someone experienced, greater likelihood as they get older, higher levels of depression, anxiety, sleep issues. There's plenty of studies that talk about this within the context of eating disorders, substance use disorders, criminality. The list goes on and on and on. We offer multiple trainings related to the adverse childhood experiences literature through APHIS. When we study this within the context of food and diet and nutrition and health outcomes, this is a good visual reminder that there's been multiple studies that have looked at the adverse childhood experiences research within the context of obesity, binge eating disorders, food addiction, irritable bowel syndrome, inflammatory bowel disease, certain kinds of hormonal dysregulations. All of these things can contribute to poor physical and behavioral health outcomes. If we look at the adverse childhood experiences literature through a criminality lens, these are some community and neighborhood factors you want to take into account. The adverse childhood experiences literature is vast. There's all kinds of variables to take into account. But if we were to look at this through a criminality lens, by no means am I saying someone that's had extensive childhood trauma is going to grow up and commit crimes. But these are some of the other factors to consider that could play a role in bringing some clients with an elevated ACEs score into contact with the criminal justice system. One of them being food insecurity, which we'll talk about in just a little bit. Food insecurity, when we think about this, what is food insecurity? This is really on a spectrum. You could have full-blown famine where you see in some countries around the world where there's starvation. In the United States, for people that have really fall under the umbrella of food insecurity, it could be individuals that don't have access to enough food, absolutely. It could be individuals that have access to plenty of food. However, the food they have access to is not good for them. So it really is a spectrum. When you study food insecurity, you want to understand food swamps, food deserts, we'll talk about in a few minutes. The consequences associated with food insecurity in children, we'll talk about children right now. It's been linked with more digestive health issues, headaches, and obesity. It's been linked with more academic problems. You'll find some studies that talk about children who fall under this umbrella may have reduced test scores, lower school achievement, and through behavioral health lens, children who are dealing with food insecurity may be more likely to be dealing with externalizing and internalizing behaviors, poor social skills, amongst other things. So this is a huge topic to be aware of. And taking a look at this, another reason why we want to study this topic and care about it, and why we should maybe refer clients to nutrition, especially with extensive trauma histories. Eating a plant-based diet could play a role in helping offset some of the consequences associated with high degrees of early childhood trauma. If you work with clients that have had extensive childhood trauma, and this could be in childhood or prenatally, a lot of times the client will be dealing with some level of emotional dysregulation. And these things have been linked with more problematic eating behaviors, more eating disorders, hoarding behaviors, restrictive eating patterns. Very, very important when you're working through a trauma lens, an attachment lens, an emotional dysregulation lens, to also consider the role and impact in some cases that problematic eating patterns may play. Child maltreatment, ACEs, the list goes on. Study after study have shown that this could relate to more disordered eating patterns, including binge eating. When we think about child maltreatment, multiple variables to consider, multiple subtypes: physical abuse, emotional abuse, physical neglect, emotional neglect, sexual abuse. If any of you are working with children who have a history of being bullied, there's some literature too that supports the fact that being bullied may play a role in problematic eating patterns. When we think of bullying literature, there's all kinds of studies that have looked at this, but you have physical bullying, relational bullying, verbal, material bullying, cyberbullying. I've consulted on multiple cases where bullying has been a factor in this client's life. So if you're working through a trauma lens, consider that being bullied, humiliated, and teased is a type of trauma. If you go through tons and tons of studies on bullying literature, this is what the research literature says. These are some potential long-term consequences associated with being bullied. Increases in anxiety and sleep problems, fear. It's been linked with more thyroid problems. For some people, more muscle pain. The list goes on. Professionals, and if you're working in the helping professions, we are all at risk for burnout. Burnout and poor dietary practices often go hand in hand. If someone is dealing with burnout, eating a healthy diet could play a role in minimizing burnout symptoms. So within the employment context, it doesn't matter what employment setting you're in. Be aware of vicarious trauma, compassion fatigue, burnout. These are negative emotional outcomes that can happen within the context of employment settings. These are some of the symptoms associated with vicarious trauma. We could spend all day on these topics, but again, you might have more mood dysregulation, self-identity issues, spirituality issues, the list goes on. Compassion fatigue, a lot of they're very similar in symptoms, but negative emotional arousal, sleep issues. You may just feel more unhappy at work. You bring your negative emotions home with you. It can impact not only your work life, but your home life. Burnout symptoms, daytime fatigue, depression, anxiety, sleep issues, more physical health impairments. Maybe it's feelings of helplessness, hopelessness. If you are really interested in developing a burnout prevention program for your organization and staff, there's a very strong argument to be made to also incorporate a nutritionist, a dietitian into the equation in terms of someone that could provide some consultation and education. You'll find numerous studies that talk about dietary practices can play a role in reducing or preventing burnout. These are some of the factors to consider if you're interested in developing a burnout prevention plan. Just looking at this through a neuroscience lens, a psychological lens, a health and wellness lens, developing a holistic approach to helping your staff and organization thrive is really recommended. And if you look at the diet and burnout literature, and there's a lot of studies on this, take a look at this. This is kind of a snapshot of what the literature says. So if you're a professional, you're dealing with burnout, maybe your organization's dealing with burnout, your coworkers are burnt out. How does diet factor into this? Again, it's different for everybody, but the research says it could play a role in more impulsive eating, more emotional eating. Burnout can impact decision making. It can contribute to poor nutritional literacy. High degrees of burnout have been linked with increases in fast food, junk food, vending machine food consumption, sugar sweetened beverages, energy drink consumption, which should indicate high levels of sugar, more meal skipping. It could be a factor in blood sugar dysregulation, which then all trickles down into making the burnout symptoms worse. And it could accelerate other poor health outcomes. The next section is specific to the criminal justice and forensic mental health systems. Study after study supports the infusion of dietary nutritional practices into the forensic systems. It's not just me saying this, lots of studies are talking about this. So, for forensic psychiatry rehabilitation settings, this is one article that talks about supporting healthy eating habits in these settings could play a role in improving client outcomes. When you study criminality, it's complex, as I showed you before. In the beginning, there's all kinds of biological factors to take into account, psychological, social, family factors, even genetic and prenatal factors. These are a few variables to consider when you study criminal behavior. What someone eats is a factor to take into account. Environmental toxin exposure, food additives, not getting the proper nutrients, undiagnosed food allergies, sedentary behaviors, and getting a lack of sunlight. These are all variables that maybe we don't think about within this context. Other factors to consider earlier on in life, so early health risk factors that could set some people up for negative behavioral outcomes later on in life. Prenatal trauma, early childhood trauma, nutritional deficiencies, maternal smoking, mom's depressed during pregnancy, birth complications, head trauma, lead exposure, high degrees of childhood trauma are just some of the early health risk factors that could play a role. There's a lot packed in here, but I underlined kind of the important parts is if you study criminology as a whole, most of the time, people that do this work have given very little attention to the role and impact nutritional factors play in antisocial behavior. One of my master's degrees is in criminal justice, and I completed that degree program several years ago. And looking back on the program, great program. I'm not knocking it at all, but I don't recall ever once hearing any of the professors ever talk about the role and impact that nutrition could play. It's just not talked about often in criminology-based programs in my experience. But study after study talks about the role and impact that poor dietary practices, nutritional deficiencies may play in this discussion. So if you're working with somebody that had a long history of poor dietary practices, nutritional deficiencies early on in life or in utero, it could impact brain functioning. And as that person gets older, it may predispose them to more problematic behaviors. And some of these deficiencies could be protein, zinc, iron, omega-3 fatty acids. We'll talk about that today as well. Again, these are some biological factors. We talked about this, but just another article that talks about some of the biological factors that could play a role in criminal behavior. We're going to talk about hormones in another training, the diet today, pollution exposure, neurotransmitters, brain injuries, prenatal problems. Again, study after study, some of these studies are older, some are newer, but there are multiple studies that have talked about it's very important to consider nutrition in this discussion. It's not the only factor, but the more I learn about this field, I'm convinced it could be a missing factor to take into account in the criminal justice system. What would happen if the criminal justice system learned about these topics, screened for this, took it into account during sentencing, during confinement, people were given more healthier foods, increasing nutritional literacy? I think it could play a huge role in reducing future criminality. If you study the literature on nutrition and crime, again, a lot of studies out there, these are some of the main themes. These are studies that have looked at this relationship. So prenatal, postnatal malnutrition, food insecurity, junk food, omega-3 fatty acid deficiency, food allergies, candy consumption, energy drinks, gut brain health access. It's looked at it within the context of mood problems, anger, violence, aggression, bullying. A couple studies have looked at it within the context of domestic violence, the juvenile justice system, adult prison populations, clients on probation, the list goes on. So there are multiple studies that have looked at this through a number of different variables. When you study this nutrition crime relationship, the research literature absolutely stresses the importance of also understanding the gut brain health axis. Now, we had a whole training dedicated to this topic, so I'm not going to spend a lot of time on this. But just know if someone is not eating well, they're dealing with nutritional deficiencies, more times than not, it's not just impacting the brain, but it's impacting the gut. So if the gut and the brain are off, there's a higher likelihood a client may be dealing with more mood instability and more problematic behaviors. So this is the gut brain health axis in a nutshell. I'm just going to show you visually here. You have the handouts. We covered this in detail during that other module. Why do you want to care about the gut and gut dysbiosis and the gut microbiota? Because when the gut is working properly, it can play a vital role in our immune system, metabolism, our circadian rhythms. When the gut is off, it can play a role in chronic diseases. You will find numerous studies that talk about this within the context of obesity, diabetes, cardiovascular disease, central nervous system disorders. So poor nutrition can impact neurotransmitters, it can impact the gut, and all of these things together can impact the brain, and it could play a role in contributing to problematic behavior and maybe even aggressive behavior in some cases. When our neurotransmitters and neurohormones are off, these are some of the potential consequences that may result. We have an entire module we're going to do just on these topics. But if you are working with clinical or forensic clients, there's a pretty good likelihood that you're probably working with clients with neurotransmitter and neurohormonal dysfunction on a semi-regular basis. When we talk about this through a nutrition lens, again, I'm not giving any nutritional advice. I just want to show you what some of the research literature talks about. This one particular article talks about this. These are some of the best dietary practices for neurological regulation, particularly for the optimization of neurotransmitter production. So taking into account proteins, complex carbohydrates, what kind of saturated fats is someone getting, being aware of olive oil, omega-3 fatty acids. There's a lot of things packed into this that we're not going to get deep in the weeds into, but if your client is ever referred to a nutritionist dietitian, these are things they would probably focus on. And again, while we're still on the gut, there's a multitude of factors that can adversely impact the gut-brain health axis, including what we eat. And again, if the gut is off, it has been linked with more health problems. Again, if the gut is off repeatedly and someone's not eating healthy over and over again, they're just not taking care of themselves, it could contribute to some of these things. So be aware that there are multitude of health conditions associated with gut health access dysfunction. Cigarette smoking throws off the gut. Targeted area for intervention is to help people quit smoking. People are surprised to hear this as well, that maybe helping people quit smoking could play another role in reducing criminal behavior. If you look at this statistic, 70 to 80% of people who've been incarcerated may smoke cigarettes. This is 3 to 4 times higher than the general population. I have a certification in as a tobacco prevention specialist through the Mayo Clinic. I got that a few years ago. Wonderful program, as an online program, went through, very comprehensive, and really fascinating to learn how many variables we need to take into account when we're talking about tobacco and nicotine and secondhand smoke. If you work with clients with psychiatric disorders, taking a look at this particular article that highlighted all kinds of different psychiatric disorders where smoking may be more common. Most of the clients I have worked with over the years who have a very serious mental health issue also smoke cigarettes. Not 100%, but most, in my experience. When you study diet, antisocial behavior, looking at the history, you know of Lambrusso's work. I talked about that, his work in the first training module in this series, but his work dates back to the 1800s. And he was talking about the role of diet in some instances of antisocial behavior. Poor diet can play a role in executive functioning problems, impulse control issues as well. So very, very important to understand this one within the context of brain-based functioning capacities. Most clients in clinical forensic settings are probably dealing with executive functioning impairments on some level. If you work with clients that are dealing with these kinds of issues day in and day out, that should be a very strong red flag indicator that your client is likely dealing with some level of executive functioning impairments. When we look at executive functioning impairments through a offender-based lens, multiple studies point to the fact if you're working with folks who've been in prison, there's a higher likelihood that they may be dealing with planning deficits, self-monitoring issues, organizational problems, disinhibition. They have inflexible thinking. All of these things could impact goal planning and goal achievement. In the cases I've consulted on over the years, these are just some of my observations where I've seen consistent patterns come up. This is not an all-encompassing list, but through my training in executive dysfunction, I've also seen clients with a high degree of fatigue, irritability, increases in depression, concentration problems. They might be more prone to accidents, which could be a factor in sustaining a head injury. Decision-making issues, sleep problems, high levels of self-doubt, shame, social skills. This is a article I wrote that you can find online. It's a very practical article that just talks about some interviewing considerations when working with clients who are involved in the criminal justice system, who also have executive functioning impairments, just some very helpful reminders to consider. And it's another short read, about a 3 to 5 minute read. If you work with clients with impulse control problems, these are some variables you'd want to consider. A high percentage of folks in prison, drug and alcohol treatment programs, probably are dealing with some level of impulse control related problems. So these are some variables you'd want to take into account. And when we think of like impulse control, got to consider self-control deficits. We spoke about self-control a little bit ago, but if someone is not eating properly day in and day out, they may not be getting the proper nutrients to feed their brain, which could contribute to more self-control deficits. People, again, with high levels of self-control likely do better in relationships, in school, achieve their goals more effectively. They're less likely to come into contact with the criminal justice system, and they're less likely to be dealing with severe mental health challenges. So targeting self-control, very, very important with clinical and forensic populations. On the flip side of that, clients with very low levels of self-control might be more likely to engage in maladaptive behaviors, including a potential increase in criminality, drug and alcohol problems, and even excessive screen time exposure. And it's also been related to binge eating problems, possibly bullying other people, and procrastination. High levels of procrastination really are a self-control issue. And these are traits and red flag indicators just to be aware of when working with clients. So if you are working with clients that have a consistent pattern of some of these behaviors, that should potentially indicate that that client may be dealing with lower levels of self-control. From an eating lens, teaching self-control is talked about in the nutrition literature. So for some nutritionists and dietitians, teaching clients self-control skills may play a vital role in helping that client make better choices when they go to the grocery store, helping that client be more mindful and planful around the meals they make. They might use their time more effectively. We're not going to spend a lot of time on this, but just want you to be aware of that there are studies that talk about amino acids within the context of aggressive and violent behaviors. So if that client is dealing with deficiencies in this area, it could be a factor in some instances of aggressive and violent behavior. A couple studies talk about diets that where someone consumes a high degree of high trans fat diets, it could play a role in aggressive behaviors. Again, there's multiple other variables you'd want to take into account. Vitamin B deficiencies have been talked about as well within this context. Vitamin B deficiencies play a huge role in neurotransmitter dysfunction. It plays a huge role in more behavioral health challenges. Food sensitivity is a huge topic too to consider. So for some clients, they may be dealing with food allergies, food adversities, food insensitivities, things of that nature. So if that client can get properly diagnosed and treated, it could play a role in reducing problematic behavior in some instances. The consumption of lots of sweets and candies has been talked about in this literature as well. Again, most people that consume a lot of candy are not going to grow up and commit crimes, but it could be a factor in some instances. And when we think about this too, these are just some of the variables, some of the things to consider under this umbrella. High calorie malnutrition would be basically, I would consider this potentially a factor associated with food insecurity in some cases. So these would maybe be clients that don't have a lot of money, can't buy nutritious foods, but they're getting a ton of calories from really highly ultra processed foods, fast food, gas station food. High calorie malnutrition could play a role in violent behavior because, again, if you're not getting the proper nutrients, the brain's off, guts off, blood sugar dysregulation, to name a few. A couple studies have looked at this within the context of junk food consumption. Not a lot, but there's some. So a client is consuming a high degree of junk food, foods that fall under the Western diet. It could impact the brain, the hippocampus, various parts of the brain, executive function, prefrontal cortex, the hippocampus, the amygdala. And if these parts of the brain are off, it could play a role in more problematic behavior. Not a lot of studies on this, but some. So if you're working in domestic violence treatment, intervention, prevention, you're working in programs that work with survivors or perpetrators, another variable to consider that domestic violence obviously is a huge trauma, a huge stressor, and it could change eating patterns and contribute to more sugar consumption in some cases. This next section will be talking about blood sugar dysregulation. When you think about blood sugar dysregulation, you want to be aware of the hypoglycemia aggression hypothesis. If you want some more information on this topic, shoot me an email, and I'm actually putting together some good handouts on this very topic. But people are surprised to learn how many studies have actually been published on the topic of hypoglycemia within the context of problematic behavior. It's been studied within the context of impulsive aggression, impulsive personality disorders, violent offending behavior. When our blood glucose levels get too low, hypoglycemia, we don't have enough metabolic fuel to fuel our brain. And if we don't have enough fuel in our brain, that can impact executive functioning capabilities and contribute to more self-control deficits. So, in a nutshell, if you look at this research literature, studying the hypoglycemia aggression hypothesis is important. It talks about serotonin abnormalities being a variable, executive dysfunction, central nervous system issues, poor self control, to name a few. And when we're talking about this too, so if the human body isn't metabolizing glucose effectively, that could trigger more self control deficits, which could trickle down into more aggressive behavior under the right circumstances. Study after study has looked at this as being a factor, but I don't suspect this is a topic that's widely discussed in criminal justice or forensic based training programs. But I think it should because there's enough studies out there that talk about hypoglycemia being a factor to take into account. Low blood sugar levels trigger more irritability. It could trigger more violence in some cases. The brain's impacted. This study was done on impulsive homicide offenders. There's, again, study after study that have looked at these things. Another study looked at this within the context of fire setting behavior. So if any of you are working in the area of fire setting, arson, just something to be aware of. Other things to consider too, it could be a factor within the context of severe intimate partner violence. So if you're working with individuals who engage in intimate partner violence, being aware of this particular article and study. This next section, still looking at this through a criminal justice forensic mental health lens, but we're going to look at some of the prenatal and childhood factors that we want to take into account. So if the individual is dealing with severe nutritional deficiencies early on in life or in utero, this could set that person up for future antisocial behavior as they get older. Again, it's not as simple as just the nutritional aspect of this, but there's other variables to take into account as well. If you look at this through a maternal prenatal factors lens, these are some of the other variables you want to consider. Obviously, diet, huge factor. What was mom's psychiatric history like during pregnancy? Was she dealing with any neurological issues? What kind of medications was she on? Was she using drugs or alcohol? What was she eating or the lack thereof? What kind of sleep was she getting? Was she dealing with trauma, diabetes, maternal epilepsy? Could there be some thyroid problems? Was she overweight during pregnancy? Was she dealing with chronic low-grade inflammation or autoimmune issues throughout the pregnancy process? If you want to support proper prenatal development, the research literature says maintain regular contact with the healthcare provider, eat healthy, get good sleep, promote good dental health, ensure the pregnancy is free from drugs, alcohol, tobacco products. It talks about limiting caffeine, doing appropriate forms of exercise, managing stress, managing normal weight, having good social support. Again, doing all of that in conjunction with the healthcare provider. Another study that just talks about prenatal nutritional deficiencies could increase risk of antisocial behaviors in adulthood. If you look at literature out there, resources online, the consequences associated with prenatal stress, depending on where that stress came from, these are some of the variables talked about in the literature. So this is a huge topic. And through my neurocriminological lens, if you want to prevent or combat future criminality, start in utero. Other things to consider associated with high degrees of prenatal stress. It could contribute to more attachment problems, stress hyperresponsiveness. This could be indication of maybe amygdala dysfunction. It could be a factor with central nervous system dysregulation. It could increase risk of diagnosis of asthma, allergies, temperamental issues as the person gets older. Mom during pregnancy maybe was dealing with some level of malnutrition. Again, this study just talked about how this could play a role in later aggressive behaviors. So, prenatal and early childhood nutritional deficiencies, many studies have looked at this. These are some of the potential consequences that could result. Again, everybody is different, but it could impact behavior and learning, to name a few. When we think about prenatal malnutrition, it could also play a role in future addictive behaviors. When we consider this, these are some of the variables you want to consider within this context. What happens if mom was dealing with gut health issues during pregnancy and early on in life? This could play a factor in negatively impacting that infant's gut microbiota. So these are some variables to consider. Was mom smoking during pregnancy? Malnutrition? Was she dealing with lower socioeconomic status? Other things to consider: malnutrition during the first years of life could contribute. Growth deficiencies as the child gets older, more academic problems. Lots of factors that could contribute to malnutrition. This is a complex and multifaceted topic, but these are variables you want to consider. Dietary factors, feeding practices, the educational level of mom. Was mom dealing with mental health issues among multiple other variables? Just another study, and some of these studies date back multiple decades and some are more recent. But taking a look at this study from 30 years ago talked about a decrease in antisocial behaviors were observed among incarcerated youth when unhealthy dietary practices were removed from their diet. Other things to consider, again, study after study. I'm just throwing out some studies at all of you, hopefully to get buy-in that there's enough research literature out there. It's pretty important for us to consider this topic. Other things to consider. So when we're thinking about like externalizing behavioral problems, these would be adolescents that might have a tendency to get into more fights and have more delinquent issues. Lower consumptions of certain kinds of vitamins may increase higher rates of externalizing behavioral problems. Study after study, again, we've talked about zinc a little bit today. We haven't really talked about iron. We talked about B vitamins and protein a little bit. It could lead to lower levels of IQ. Even excessive sodium intake has been talked about as maybe being a factor among some preschool age children to exhibit more externalizing behavioral problems. These are externalizing behavioral problems right here. These are internalizing behavioral problems. Very important to consider both. Children with externalizing behavioral problems may have more learning, reading, comprehension kinds of issues. And if we look at this through a sleep lens, children who are chronically sleep deprived may have more externalizing difficulties. Another reason why it's so important to consider this through a holistic integrative lens as well. These are some of the predictors found in the literature that may exacerbate externalizing behavioral problems in children. And again, the food allergies, food sensitivities, there's some articles that really talk about this within the context of young offender populations as well. So routine screening for these kinds of things within these settings may play a vital role in addressing some of the contributing factors to maladaptive behaviors in this population. Other things to consider: early intervention for nutritional deficiencies could play a vital role in improving overall behavioral outcomes in children, even throughout the lifespan. Thiamine deficiency is something to take into account as well. We haven't talked about that today, but it is a variable you'd want to consider. Even chronic alcohol use has been linked with more thiamine deficiency. This next section is related to correctional officers, probation, folks that work with individuals who are in confinement settings and on probation or parole. Unfortunately, we know that a high degree of individuals who are incarcerated deal with a high degree of health disparities, and that the level goes up when we're talking about this too through the lens of working with clients with very serious mental health issues. These are some of the variables you'd want to consider through this lens. Poor nutrition, very common in prisons. I'm not pointing out any particular prison, but if you look at empirical based literature, news stories you'll find in the popular media, as a whole, nutrition within confinement settings typically is not that healthy for individuals who are serving a sentence. The prison environment is obviously very complex. These are some variables to take into account when you're working with folks who've had a history of incarceration. Article after article, again, just talks about people in prison oftentimes consume more highly processed sugary foods that can lead to sudden spikes in blood sugar levels. This could cause more fatigue, irritability, dizziness, insomnia, and contribute to more depression. Just wanted to throw this in here, some positive things. There's some prisons, some articles around the world and country that are starting to utilize prison-based garden programs and have really shown that if prisons maybe moved in this direction, it could play a role in reducing future instances of re-engagement in the criminal justice system. So the use of prison garden programs has been shown to help inmates improve self-efficacy, self-worth. It's been shown to reduce anxiety and depression. Just something to take into account. If you work with folks who've been in and out of prison, lots of factors to take into account. Obviously, nutritional factors. Most folks in prison have had trauma histories. Head injuries are very common. Very important to understand the complex needs of individuals who fall under this umbrella. Parental incarceration has been linked with more sleep and eating problems among the children who have a parent who's incarcerated. Parental incarceration is a type of adverse childhood experience. A very high percentage of people in prison deal with insomnia. Chronic insomnia within prison populations may increase aggression, anger, impulse control issues, and even suicidality in some cases. Multiple studies have looked at sleep issues within the context of the prison population. These are some of the risk factors that are talked about in this research literature. So parental incarceration, so a child who had a parent who's incarcerated, that child without proper supports and services may be more likely as they get older to be dealing with some of these kinds of issues. Other things to consider when you are working with offender-based populations, the research literature talks about considering nutritional status and even considering it within the context of domestic violence offenders and psychiatric forensic kinds of clients as well. Again, study after study, multiple articles talk about nutrition and poor dietary practices among folks who've been incarcerated. Poor eating habits in prison over a long haul could weaken that individual's immune system and make them more vulnerable to illnesses and diseases and viruses. What happens if you're working with individuals in these settings who are older or elderly populations? More and more studies are coming out about this specific topic as well. Foodborne illnesses may be more common among prison populations. It's another variable to take into account. Helping offender-based populations eat better, very important targeted area for intervention. This research talks about also vitamin D. Several studies have also found that offender-based populations may put on more weight when they go to prison because of the very nature of the food they're getting and the sedentary behaviors and maybe higher levels of stress and sleep problems. These are a few variables to consider about obesity and weight gain among offender-based populations. It is a factor to take into account. This is a great article that just talks about some of the menus that are served to inmates within these confinement settings. So this article talked about the foods that are served in prison may have higher amounts of sodium and sugar and lower levels of fiber, magnesium, potassium, vitamin D, and vitamin D than the daily recommended intake. So poor health outcomes, pretty common among offender-based populations. Again, every confinement setting is different. These are some other factors you want to consider. Limited food choices, sedentary behaviors, inadequate nutrition. Again, a high percentage of clients may be dealing with this and some other comorbidities. When we think about offender mental health, you work with folks coming out of prison, they have serious mental health issues. Lots of other variables to take into account here. These are some of the variables you'd want to consider. Incarceration, fast food consumption, and smoking has been studied simultaneously. So this is another variable to consider. If you're working with folks with a history of incarceration, they may have higher fast food consumption rates and they may be more likely to smoke. Why should we care about tobacco smoke? Because it could be a factor: sleep, anger, impulsivity, and emotional lability. And I just wanted to see what the literature said about solitary confinement. Something to be aware of. I pointed this out in the digestive health, gut brain health training. But if you've worked with clients that have had a history of solitary confinement while incarcerated, it's another variable that could have contributed to poor health outcomes. If you are a probation officer, you work with folks on probation, it's imperative that probation and parole departments, in my opinion, understand the role and impact that chronic diseases play as well, because chronic disease states may be more common. This is just one article of many that talks about chronic diseases and other health disparities that may be more common among some of your clients. And when you're working with probation populations, especially probation populations with more higher needs, these are just a few reminders and variables, different things we want to take into account that I have seen in some of the cases I've consulted on. And if we look at this through a mental health lens, what are some factors that could make mental health even worse? So these are some of the social determinants we might want to consider through a comprehensive screening evaluation process. Food insecurity has been talked about within this context too. A high percentage of people on probation may actually be dealing with food insecurity. So this is a very important target area for probation parole officers to be aware of as well. We know that offender reentry, it creates a lot of challenges and barriers for some individuals. Also adding to this list, the role and impact that food deficiencies, food insecurities can play. These are just a few of the variables you'd want to consider through an offender reentry lens. As we get deeper in the weeds with food insecurity, again, as I mentioned before, it's a spectrum. It's a serious public health issue. It can vary in level of severity. True food insecurity over a long period of time has been associated with many physical and emotional and behavioral health outcomes. These are the major characteristics of food insecure individuals: having access to only poor quality of food, lack of food choices, unbalanced diets, and meal skipping behaviors. Again, the consequences are many and varied: increased risk of asthma, brain-based problems, academic issues, psychiatric problems. Just visually showing you here again, it's been associated with all kinds of different health-related issues. People who have a high degree of food insecurity, it could be a factor in diabetes, hypertension, dental health problems, depression. I mentioned food swamps before. This is a topic and a term you'd absolutely want to become familiar with. Food deserts is another topic you'd want to be aware of. Food insecurity could play a role in accelerating high-risk coping behaviors. There's multiple studies that talk about food insecurity within the context of self-control deficits, anger, aggression, violence. I do believe this is a factor that we all need to consider when working with clinical and forensic populations. If you're working in violence prevention programs, you want to understand violent behavior on a deeper level, understand food insecurity. It is a variable to take into account. It could be a factor in accelerating domestic violence. You will find a good handful of studies that talk about this within the context of child abuse and intimate partner violence. So if you're working in any of those programs, getting more training around this topic is recommended. If you work with formerly incarcerated individuals, multiple studies talk about this. And again, a call to action: if you're working in corrections or probation, there's a lot of articles that really stress the importance to learn about food insecurity. This next section is about screening considerations we'd want to take into account. I think it's important to be aware of the research literature pertaining to the first 1,000 days of life. This is day one of conception all the way up to the age of 2. Very important to understand this critical component of early childhood brain development, body development. Poor nutrition during the first 1,000 days of life has been linked with multiple health outcomes. If you're working with clients that have a long-standing history of having poor dietary habits, these are a few variables you'd want to consider. Most nutritionist dietitians would take these into account, so these might be good target areas for potential intervention. If your client lacks knowledge about nutrition, that's a factor. If they have planning deficits, that could be an executive functioning impairment. Helping them learn skills around these areas can improve dietary quality. These are potential barriers to eating a healthy diet. So, just some variables to take into account. Culinary traditions, maybe there's some social pressures. The person is just go, 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 and just doesn't have time to eat. They're eating snacks, fast food, food that can be made in a minute in a microwave, vending machine foods. These are variables to consider that are potential barriers to healthy eating. A lot of factors that can impact dietary patterns and quality. Smoking plays a role. Our income level, our educational level, marital status, lots of things. What are some factors that predict food selection among adults? Take a look at this. Taste, cost, the nutritional value, convenience, pleasure, weight control are some of the main factors predicting food selection among older individuals. Some other things just to consider through the screening lens that a qualified healthcare professional may take into account. What's the client's overall food related values, knowledge, attitudes, and skills? These are very important areas to consider. What happens if your client is dealing with any of these problematic coping strategies? Targeting problematic coping strategies could be a very helpful way to maybe help your client live a healthier life. Stress eating, binge eating technically would probably fall under this umbrella of a problematic coping strategy. Excessive sugar consumption, excessive energy drink consumption, all variables to consider. Consider these things too within the context of COVID-19. How has COVID-19 factored into this discussion? When we think of some of the stressors associated with COVID-19, maybe it's increases in mood swings, irritability, maybe there's a higher degree of fear, sadness, anger, guilt, maybe they're dealing with a high degree of disorientation or shock. Have they started to consume alcohol, tobacco products, drugs, caffeine use, prescription medication factors? Has their sugar intake increased? Are they consuming a high degree of fast food now? Maybe COVID-19 related stress has contributed to an increase in denial or detachment or avoidant behaviors or concentration issues. Maybe there's some decision making problems, or it's contributed to more relationship conflicts or sleep problems. All of these factors could be a potential trigger for changes in eating patterns. So, looking at your client's level of stress, anxiety, and disruptions they had as a result of COVID. Eating competence, another variable to take into account. This is a very important target area that some nutritionists, dietitians will absolutely take into account is what is that client's overall level of eating competence like? Again, we talked about trauma before. We had a whole section on this, but just know that high degrees of childhood trauma could play a role in problematic eating patterns. And if a child grew up and they were dealing with a high degree of food insecurity, there's a very strong argument to be made that that really would constitute a type of adverse childhood experience. When you're working with clients that have had a long-standing pattern of childhood trauma, they might be dealing with more anxiety, more depression in adulthood, more fear. There could be higher levels of anger and apathy, Do they have an abandonment history? Now they feel really abandoned and rejected. This could contribute to higher levels of feelings of hopelessness, helplessness, higher levels of shame and guilt. These are all things that can make behavioral health and physical health outcomes much more worse. Taking into account your client's lifestyle and social history. So, depending on what kind of role you play, if you're looking at this through a lifestyle and social history lens, what's their physical activity like? Are they living a sedentary lifestyle? Do they want to exercise? Are they dealing with joint pain? Maybe they do well working with an exercise specialist. What's their intake of fruits, vegetables, processed foods, alcohol, soft drinks like? Do they want to eat healthier, but they don't have availability to get access to fresh foods? Sleep, considering cultural considerations, employment status. What is their family system like? What kind of supports do they have? Do they have good friends, good coworkers, financial status? These are all things maybe to consider through a comprehensive lifestyle social history lens. This comes out of the neurocounseling literature, but these are some variables you might want to consider that could play a role in contributing to more neurological dysregulation. So maybe there's some genetic factors. We talked about prenatal factors. What was going on in utero? Was mom using drugs, alcohol, tobacco products, malnutrition? The birth complications. You'll find several studies in the neurocriminological literature that talk about birth complications, disease and high fever early on in life, something to consider. Or dietary practices again, big factor. Histories of consumption of ultra processed foods, food allergies, high sugar, caffeine consumption, things of that nature. Head trauma. What kind of stress is your client dealing with? Are they on a ton of medications? Is there a history of seizure disorders, chronic pain issues? The list goes on and on and on. Literacy skills. So, health literacy, again, taking into account, do they know how to read labels? Do they have food related knowledge? Do they know how to communicate with their doctor? Do they understand what kind of medications they're on? Health literacy skills, huge variable to take into account. And it's a very important target area for intervention. You'll find there's some screening tools and instruments you'll find in the literature. One, you might want to take a look at the nutrition literacy assessment instrument. That's something to be aware of. We talked about low blood sugar levels, hypoglycemia. So this would be a factor you'd want to consider. There's all kinds of reasons why people may have dysregulation in their blood sugar levels. It could be meal skipping, excessive sugar consumption. It could be a factor related to cognitive or learning challenges, sedentary behaviors, excessive smoking, overweight status. Certain kinds of medications need to be taken into account. What about some of those poor self-control factors we considered? Untreated serious psychiatric issues, a lot of variables to take into account. Fatigue. If you work with clients with a high degree of fatigue, this is another variable to consider. Is nutritional status. Improper nutrition absolutely can play a role in accelerating fatigue. Inflammation and even mitochondrial dysfunction have to be considered within this context. Again, screen time habits need to be considered. And this article talked about excessive television watching may be associated with lower intakes of fruits and vegetables. If you work with clients that have a long-standing pattern of excessive screen time exposure, that's been linked in some cases with more vision problems, more joint pain, sleep issues, daytime fatigue. It is oftentimes associated with living more of a sedentary lifestyle. Poor time management has been talked about in this literature. It may increase anxiety and depression. It could increase conflict in your client with other people. It could trickle down and impact school performance. It may play a role in delinquent behaviors, loneliness, procrastination, task avoidance. So, this is another huge variable to consider. So, we talked about food allergies, food sensitivities. Again, maybe it's referring the client to a specialist that can test for this, and just being aware that food allergies, they might have an allergic reaction on the skin, the gastrointestinal tract. Again, I'm not giving nutritional advice, but if you look at the literature, some of the most common foods that could trigger a food allergy would be eggs and dairy and milk and peanuts and tree nuts, shellfish, wheat, soy. There's some other ones out there. Food allergies, food sensitivities may trigger more disruptive behavioral patterns. Why might that be the case? It could impact the gut. It could adversely impact the HPA axis, the hypothalamus, pituitary adrenal axis. We won't spend a lot of time on this, but aspartame, another factor to consider. If your client is consuming tons and tons of food loaded with aspartame, it is a variable to consider because it could impact the gut. There's over 6,000 products that contain aspartame, according to the research around the world. It is a variable to consider. There's more studies now being done on this. It could be a factor in causing more behavioral kinds of challenges in some cases. Energy drink consumption, again, we need to take this into account. When we think of energy drinks, these are beverages that typically contain higher amounts of caffeine, lots of sugar, sometimes other additives, and a lot of times some legal stimulants as well. They make people more alert, they have greater energy for a period of time, but they really are a threat to health. I have this high sensation seeking underlined here. That's another term you'd want to be aware of if you're interested in studying like self-control, disinhibition, impulse control issues. If you're working in substance use treatment, this is a variable to consider. A high degree of energy drink consumption may increase the risk of substance misuse among some people. So it is a variable to consider. If you look at the energy drink consumption literature, some of the potential negative health outcomes that have been talked about is increases in headaches, restlessness. It could accelerate depression, anxiety, gut health issues. It could play a role in obesity, type 2 diabetes, and even caffeine kind of toxicity overdose, depending on how much caffeine the person is having. So it definitely is a variable you'd want to consider. Some of you may have or are using cognitive behavioral approaches. Cognitive behavioral interventions have been used in all kinds of settings. I just threw up a study here that talked about this within the context of medical settings, but CBT-based approaches can help improve client education. It may help clients improve self-efficacy. It could play a role in improved goal setting, motivation, self-monitoring, problem-solving abilities. Alexithymia is a factor you'd want to consider. Alexithymia is emotional blindness. It may be a factor in health literacy. Alexithymia has been associated with higher degrees of depression, anxiety, anger, poor coping skills. 50% or more folks in clinical settings, drug and alcohol programs may be dealing with alexithymia. It's more common among folks with schizophrenia, autism, eating disorders, neurodegenerative disorders, chronic pain issues. So alexithymia, problems with making sense of emotions, naming emotions, labeling emotions, very, very important topic to consider. Temperament is a factor to take into account. Temperament's a really fascinating topic. Depending on that client's level of temperament, if they're more uptight and rigid and irritable, that could play a role in unhealthy eating patterns. So understanding temperament literature can be very, very helpful. Poor attentional control. So this can look a lot like symptoms of ADHD. It may not always be ADHD. This is indicative of some executive function impairments, but poor attentional control may be a factor in maladaptive eating behaviors, including impulse eating. So focusing on helping the client improve attentional capabilities may indirectly help that client reduce maladaptive eating patterns. Understanding your client's level of attachment, not only utilizing trauma-informed care approaches, but also taking into account your client's attachment patterns is going to be very, very helpful. And insecure attachment patterns may be associated with more maladaptive coping behaviors later on in life, including substance abuse, eating problems and eating disorders, and high risk behaviors. So if you're working with folks that have had extensive prenatal early childhood trauma, there's a higher likelihood that they may have some fractured attachment patterns. And you'll find plenty of literature in the clinical and forensic arena that talk about insecure attachment patterns likely being much higher in those populations. Screening for risk-taking behavior, self-regulation deficits, and even self-destructive behavior. Some unhealthy coping patterns, some self-destructive behaviors. Again, maybe the client is engaging in deliberate self-harm, drug and alcohol problems, smoking, unhealthy eating patterns, and even compulsive computer gaming could be kind of a self-destructive behavior that we might want to take into account through a comprehensive screening, assessment, and intervention process. And disordered eating behaviors, when you work with clients with some of these problematic eating behaviors, could it be partially linked or could it accelerate health inequities? So when you study health inequities, you want to understand health disparities, vulnerable populations, taking into account social, political, economic factors, what kind of environmental conditions or housing conditions is your client living in, nutritional factors, obviously, transportational factors, health insurance status. Is there a history of racism, oppression, or marginalization? Those are some factors you'd want to consider. And again, probation officers, parole, people working in offender reentry halfway houses, understanding a lot of those things I spoke about before in terms of health disparities, poor health outcomes. The research also points to the fact routine screening for wellness among folks on probation is recommended. These are some of the dimensions of wellness you might want to take into account if you're looking at developing a wellness intervention screening kind of protocol or plan. There's the physical dimension, intellectual, emotional, social, spiritual, vocational, financial, and environmental. Before we move into this last section, we're just going to take a quick break and we're going to wrap it up today with different interventions, tips, strategies, and solutions. Welcome back, everyone. So this last section, all about intervention strategies, tips. Some of these, I think all of us can do right away, depending on the client's background. Some of this would need to be done in conjunction with a healthcare provider. When we think about early intervention or even prevention factors, This is what the research literature says. Anytime we can increase resilience, that's a good thing. Anytime you can support prenatal care, that's a good thing. Encouraging your clients to stay in contact with their healthcare provider, getting your clients to work with a qualified healthcare provider where they could set up a healthy nutrition plan, just engaging in overall healthy lifestyle practices, all very common sense, getting good sleep, having good balance, maintaining healthy weight, having fun and laughing and being around people, not overworking and things like that. We all know, but it's difficult. We have such a fast-paced society, but just slowing down, taking breaks, very important. Obviously, avoiding tobacco and drugs and really forming strong bonds and family harmony, which basically is a big foundation of forming healthy attachment patterns. So this is not an all-encompassing list, but it really is a good reminder of why it's so important to tackle this from a holistic whole body approach, from psychological interventions to medical interventions and everything in between. So you want to combat criminal behavior? Prenatal. I'm truly believe this. This is where I focus a lot of my work on. Prenatal interventions is the foundation to life, obviously. And if that child starts out in utero on a good footing, there's a greater likelihood that hopefully they'll go through life not coming into contact with the criminal justice system again. There's so many other variables and factors to take into account, but this one study talked about prenatal interventions may reduce future risk of juvenile delinquency, even 15 years later. So go back, if I encourage you to go back to the module on neurocriminology, we talked about some of the neural interventions in there and some of the neurocriminological interventions to take into account. But in the neurocriminology literature, it does talk about vitamin and omega-3 fatty acid supplementation, as well as cognitive emotional based training programs, things of that nature, could help prevent or reduce future criminal behavior. So again, I'm a firm believer that if we started to routinely incorporate a nutritionist, a dietitian, functional medicine providers into the equation when we're talking about developing a criminal justice prevention plan, sentencing plan, helping the prisons really combat and teach offender-based populations skills and strategies that can help them be more successful when they're released. Nutrition is a big factor. Again, study after study talks about nutritional interventions play a vital role and a big part in the prevention efforts of reducing criminal behavior. Again, depending on one's qualifications, obviously they would need to be properly credentialed and licensed as a healthcare provider or a qualified nutritionist dietitian. But some studies have found that nutritional supplementation in forensic populations may reduce aggressive behaviors, rule violation problems, and reduce behavioral problems in children. Again, this is a study that was talked about. Multiple studies have looked at this. Numerous studies have dug into the topic of omega-3 fatty acid within this context. Some studies have found that deficiencies in omega-3 fatty acids could play a role in offending behavior. Higher consumptions, inappropriate consumptions of omega-3 fatty acid intake may play a role in reducing offending behavior. So omega-3s, what are they again? They're essential for brain functioning, and they could play a role in reducing or preventing cognitive dysfunction. They're critical for cell membrane functioning and structure. It plays a critical role in the HPA axis. They can play a role in all kinds of brain-based functioning, omega-3 fatty acid deficiencies and omega-3 fatty acid supplementation, major topic talked about in the nutrition crime literature. If you work with adolescents who are diagnosed with conduct disorder or some other types of disruptive behavioral disorders, there is research that shows that providing healthy nutrition could significantly reduce conduct disorder at the age of 17 and criminal behavior at the age of 23. This would be a really good article to take a look at. But if you're working with at-risk juvenile populations, you're working in the juvenile justice system, it might be worth looking into this and considering this as part of your holistic intervention plan with qualified healthcare professionals. The same with full-blown antisocial behavior. So there are studies that have looked at vitamin and mineral supplementation as a way to potentially reduce antisocial behavior. Creating a healthier correctional environment. I really think that I'm going to put a training on for APHIS in the future on this topic. How do we move the entire correctional system in a direction of health and wellness? Now, by no means am I saying that a lot of correctional facilities are not doing this in a lot of ways, but how many correctional facilities are truly taking into account gut brain health axis dysfunction, inflammation, chronic sleep issues, dietary practices, sedentary behaviors? I don't know the answer to that, but if you look at some of the research on the national and international level, it really points to the fact that several correctional facilities aren't doing those things. If you look at the research literature on ways to create a healthier correctional environment, these are things talked about in the literature, and some of these are just based on my own professional opinions and experiences. Helping that setting move to a health promoting confinement setting, improving health and nutritional literacy. Maybe it's offering more healthy food options, customized meal plans. Again, probably get pushback on this, but again, think about if the client or the individual who's incarcerated is dealing with a food allergy, a food sensitivity, they're dealing with diabetes, they may need customized meal plans, screening for food allergies, sensitivities on a regular basis, obviously in conjunction with mental health, sleep, trauma, routine screening for head injuries, focusing on improving the gut, improving blood sugar regulation, teaching offender-based populations chronic disease management, weight management programs, promoting exercise. All of these things are things talked about in the literature that could help the correctional facilities move more to a healthier environment. If you work with female offender populations who've been released from confinement, it absolutely talks about taking into account nutritional factors, chronic health disease factors. If you can support female ex-offenders, it talks about improving dietary practices, improving dental health, being aware of blood sugar dysregulation. Basically, this article talks about dental health issues as being a variable that could contribute to poor health outcomes and blood sugar dysregulation, especially if the person doesn't have teeth or has a lot of dental pain. Promoting not only good eating practices, but exercise. Lots of studies talk about exercise, and you'll be shocked to find out how many studies have talked about the use of exercise within prisons, including yoga, therapeutic gardening, all kinds of things. Horticulture therapy is talked about, therapeutic gardening. Horticulture therapy has been associated with improved memory, language skills, socialization, problem solving, the list goes on. Providing dietary education may be a way to Reduce criminal recidivism. It's supported in the literature. If a client goes to nutritional counseling, what are some things that nutritional counselors do? What are the benefits of nutritional counseling? These are just a few to take into account. Enhances overall health and wellness, well-being. It can play a role in supporting emotional and behavioral health, improve sleep health, and help the client improve their hormone health, gut health, self-esteem. So nutritional counseling done by a qualified licensed professional, the benefits are many and varied. If you were to use a holistic approach, these are just a few things to consider in the holistic intervention literature. Mediterranean-based diets, exercise, meditation, quit smoking. These are all holistic interventions. Providing clients with psychoeducation, teaching clients about these topics. If the clients don't even know these terms, a frontline intervention is to teach them about them. Psychoeducation can be extremely empowering. Psychoeducation can be done one-on-one, in a group, face-to-face, online. It can even be done through educational handouts. Encouraging healthy eating habits. There's all kinds of things that qualified healthcare professionals can do. Tip sheets, recipe collections, resources, different cooking videos, learning your client's learning style, all kinds of things. Maybe referring your clients to different organizations that offer some cooking classes in the community. Intuitive eating is another variable to take into account when we're talking about this literature. Basically, intuitive eating is teaching clients to learn how to stop eating when they're full. It's teaching clients how to listen to their bodies more effectively. And it's teaching clients maybe not to finish their entire plate. And if you can not overeat, that's been linked with positive health outcomes. Mindful eating interventions, other interventions used by qualified nutritionists, dietitians. Focusing on mindfulness-based approaches is talked about in the literature. So mindfulness-based eating awareness training is another kind of intervention that might be considered. From a family systems perspective, from an attachment perspective, be shocked to learn how many studies have been published on the benefits of sitting down and eating as a family. Kids that sit down with their families and eat meals consistently typically have better outcomes compared to children who never eat with their families. Families that never eat together, I'm not saying there's dysfunction in that family, but that could alert the professional to maybe that family is overstressed, have some time management things, but sitting down eating together is linked with all kinds of positive things. Integrative mental health care, these are some approaches that are talked about and used, working with therapists, mind-body therapies, focusing on positive lifestyle changes. Again, we talked about mainly the diet today, but exercise and sleep, they all go hand in hand. There's a whole push in the psychiatry literature. So if you work with psychiatrists, this comes out of the neuropsychiatric literature, just something to be aware of in this literature. It talks about what constitutes healthy eating practices. Most of this is common sense, but just being aware, meal skipping, avoiding sugar, sweetened beverages, eating complex carbohydrates. Again, working with a qualified nutritionist, this may differ from client to client. In the neurocounseling literature, it does talk about therapeutic lifestyle changes. This is another approach you might want to consider, but in this literature, it talks about nutritional interventions, weight management strategies, sleep improvement, exercise, and screen time reduction as therapeutic lifestyle changes. If you want to target biological, psychological, and social factors, cognitive training, exercise, nutritional interventions, positive social activities, and also teaching your client how to monitor health risk factors by maybe going to the dentist routinely, staying in contact with their healthcare provider. Substance use treatment programs, again, just to remind you, you would probably do well learning about this literature, working with qualified healthcare professionals, developing a holistic intervention approach. In the nutrition literature, there's also a subcomponent that talks about the use of trauma-informed nutrition assistance programming. If you've ever had training in trauma-informed care, it's rooted in that, but really looking at it through this nutrition lens as well. The Mediterranean diet oftentimes has been associated with better health outcomes. It's probably one of the more studied dietary practices out there. A Mediterranean diet would consist of this. I'm not advocating for anyone to go tell your clients to start eating this way. It's just pointing out what the literature says. Let a qualified healthcare professional prescribe this diet to the client. Breakfast skipping is associated with poor health outcomes, including poor nutritional status. So this could be a target area for potential intervention. Breakfast consumption of healthier foods is associated with improved learning, behavioral, and cognitive and school performance. Proper nutrition supports neuroplasticity. Improper nutrition does not support neuroplasticity. Promoting the gut, very important. One way we promote a healthy gut is by what we put in our body in terms of food. Malnutrition, food insecurity, very important to be aware of these topics. It is so important to consider this within the context of criminality as well. Supporting health literacy, as I spoke about before, teaching clients how to learn how to read labels and just understanding what they're consuming and how to just take more control of their health and just being more mindful and active and improving self-efficacy. Helping clients develop greater self-compassion may actually help them eat healthier, exercise more, and take better care of themselves. Teaching clients metacognitive awareness, which is basically teaching your client greater abilities to think about their own thinking and know about their own knowing, has been related to improved health lifestyle practices. Clients with lower levels of metacognitive skills, these would be red flag indicators to be aware of, and it's a risk factor for criminal recidivism. This is another short article I wrote on metacognitive deficits. Very short read. It gives a lot of practical reminders and strategies. We spoke about fatigue before. Fatigue is a fascinating topic. These are some treatment strategies found in this literature. Helping clients sleep better, you would want to be aware of sleep hygiene practices. Maybe some clients are really resistant to changing. Nudging interventions can be very helpful, starting out very subtly. These are some different interventions found in the nudging literature, really fascinating research. Promoting optimism, gratitude, and as I mentioned before, self-compassion have been linked with a greater likelihood that that client engages in positive health behaviors. These are all things we know about, but it's good reminders. These are things that are associated with healthy lifestyle behaviors. Considering this within the context of healthy eating and self-care behaviors, these are some other important reminders we'd want to take into account. Some of you are probably very familiar with positive psychology. Anytime we can promote positive psychological well-being, these might be some areas to focus on and consider. So that is all I got for you guys today. Please reach out if you have any questions, and we'll look forward to having you back for our next module very soon.